to throw some technology in there. If you know Dr. Fabi, he's very involved in technology, so he's going to give us a rundown on what he thinks is the latest and the greatest. If you were at the academy a couple of weeks ago, it's really changing. You know, I used to go to the academy with my dad, and it was all about implants, and now it's about like technology and robots and navigation. It's quite amazing. So he's going to talk about what he thinks is important.
All right. First, Eric, I want to thank you for inviting me to this meeting. It's good seeing you. Been a while. And thank you to CEOA for giving me the opportunity to speak here. So, again, my name is David Fabi. I practice in San Diego, and I'm going to be talking about new innovations that are worth thinking about and what is worth trying. So, disclosures, I speak for Microport and Smith & Nephew, so there's going to be some inherent biases, I think, in here, because I'm going to speak from personal experience as to what I do currently. So I want to preface this talk by saying that we're no longer in the industrial age. That's like 20th century stuff. Now we're in the information age. So we need to get out of 20th century thinking. We need to get out of industrial age implants and surgical technique and really adopt and embrace what's going on these days. Dr. Schneezer alluded to it. You know, companies are kind of switching their paradigm, switching their philosophy from being metal and plastic companies to now being more technology-based. And I'll take it one step further, is that we're no longer just in the information age, we're in the innovation age. Back in the 20th century, advancements, technology moved linearly. Now we're moving at an exponential rate. So us as surgeons, us as doctors, really need to keep up with technology that's best practices out there, at least know about it so we can speak to it and know potentially what's available out there. So science fiction is no longer fiction, it's a reality. So let's get going. So first I'll talk about robotics. Not something that's entirely new, it's been around for the last decade or so, but it's really beyond the tipping point right now, gaining market share. This is not something that's going anywhere. Someone mentioned to me and made a good point. Think of any industry, not just orthopedics, but auto industry, where robotics was introduced and then eventually taken out. I can't think of one. You know, the auto industry is a very good example. So this is industrial age, what I talk about industrial age surgery. This is me doing a knee replacement with your extramedullary tibial cutting guide. Again, we got very good results, but we were making highly educated guesses at this point. You know, studies show that maybe 85 to 90% accuracy in terms of what we look for in a joint replacement in terms of mechanical access. We want to get to that 98, 99% range. We want to get rid of our outliers, because if you do like 1,000 joint replacements a year and you're hitting 90% accuracy, those are 100 patients where thought you could have done better, and now we're hitting 99%. So that whittles that down to about 10 patients. So a lot less sleepless nights. So this is the robotic technology that I use. Again, information age, innovation age thinking. It's a robotic smart tool that really prepares the bone to the alignment that you want, precise, accurately, and staying within your target zones. Plus, I think it's cool. I get bored easily, so I like to try new things. You know, piggybacking on Dr. Zuckerman's talk, this is what keeps me really engaged, really passionate about what I do, to keep evolving and keeping up with technology. Now, I use the Smith & Nephew Corey robotic system, but there's a lot of great robotic systems out there, all work excellently. You have your Zimmer Rosa, you got your Stryker Mako, and I know DePuy just kind of had an example of one of theirs here. This is what I use currently, small footprint. There is applications with regards to hip replacement as shown here, particularly Mako. I don't currently use robotics in my hip replacements. I do anterior approach, so I utilize X-ray. However, this is something I'm very open-minded to, something I'll probably be implementing very soon. Dr. Schneezer is very well versed on this as it applies to anterior. So what are the advantages for hip replacements? It's more efficient. Usually it's just one ream. And if you're doing a posterior approach, you can be very confident in terms of component alignment, component positioning, abduction, anteversion, limb lengths, offset, all that stuff. Now, naturally, technology continues to advance, continue to evolve. There's this Think Surgical implant that is an autonomous robot. So it's not just a surgeon using a robotic arm. You got the surgeon who attaches everything, but then you can take a step back and just watch the robot work its magic. This is like some science fiction Star Wars stuff, and I'm a Star Wars geek, so this is something that really speaks to me. And this is something that's going to continue to evolve, continue to downsize. So, future is cool. Again, let's get out of industrial age thinking. Now, next thing I want to talk about is augmented reality, virtual reality. There's a reason why Mark Zuckerberg and Facebook has spent billions of dollars and acquired the Oculus VR unit. This is something, next, the thing that's coming next. It's already going on. You got the metaverse stuff, maybe something to invest in. So we've been using virtual reality in orthopedics as a valuable education tool for residents, for fellows, for surgeons. So there's been studies that show that naturally efficiency increases when you do your surgery virtually first before you go live. Not a surprise. Here is me testing out, let's go back. Can you play that video again for me, Mike? I screwed it up. So naturally, I was a video gamer growing up, so this is nostalgic to me, just using stuff like this. So here I was learning or practicing a specific knee replacement technique. And once I did this, once I went live in a cadaver lab and then ultimately in a patient, I found myself definitely more confident, more efficient, and ready to go. So here you get a lot of practice. We use this in educational labs. What we found is that surgeons are more engaged, they're excited about it. So once we go in the cadaver lab, they're even more excited, and that we get more bang for our buck in terms of education, because the excitement level, the passion level goes up. Now, naturally, this is going to enter the OR space, and it already has. There's the Hip Insight System, virtual reality unit application with regards to hip replacement. It was relatively recently implanted. Again, some cool science fiction stuff. Again, something that catches my eye, and something that is a smaller footprint than robotic technology, so that's a niche for this type of device. No more industrial age thinking. But let's not forget about the metal and plastic stuff. It's not something that's new, but something that's becoming more and more on the forefront is cementless implants for knee replacements, finally. We have more confident porous surface, highly porous surfaces. A lot of implants out there that are working very well. You got your Zimmer Persona here on the left, your Stryker Triathlon here on the right. I use a Smith & Nephew console lock unit. This is me thinking I can get my 15 minutes of fame. I got 1 minute. And then here, just an example of me implanting these components. Super nice press fit. So I'm very confident, reassured that that implant's not going to loosen up on me in the first 6 weeks while ingrowth happens. So advantages are it's more efficient. You don't have to worry about the cement to dry. You don't have to purchase the cement, so it's more cost efficient, on top of saving you OR time. Also, most importantly, potentially there's longer longevity to the implant. First generation cementless implants showed a 95, 98% survival rate at 20 years, whereas cemented implants during that study showed 85 to 90% at 20 years. So that's the major advancement there. Going back to the evolution thing, things continue to advance. This is something that has really got me nerded out, this Persona IQ. I'll let this video explain it.
The implant features a smart stem extension.
Can you turn up the volume there?
Sensors capturing relevant gait metrics to support the goal of 100% patient compliance. Once Persona IQ is implanted, the patient recovery story begins by capturing their range of motion, walking speed, stride length, and step count. Surgeons can monitor their patient's recovery, through a convenient and intuitive dashboard as an adjunct to other measurement tools. Through objective kinematic data delivered from a pioneering smart implant, Persona IQ has been designed to help write the future of orthopedic technology.
So something that's very exciting, something that I'm hoping to implant in the next few weeks. I think you get the point here. But let's not forget about continuing to improve our surgical dissection, surgical techniques, surgical approaches. Again, some inherent bias here. I'm an anterior surgeon, used to do longitudinal. Now I've adopted the anterior path technique, doing it through a bikini incision along Langer's lines. You can do it through a smaller incision. It heals better, less painful scar, particularly really advantage in obese patients, so you have less wound healing complications. So you do a lot of your work through a cannula that was shown in the video that I inserted. Here's how I used to do it. That's far from minimally invasive on the left side. And now on the right side, here you're doing your reaming through this cannula. You don't have to stick in that reamer that potentially can retract on some soft tissues as you ream the bone. Maybe something to think about. I don't know. Plus, we're in California, so the bikini incision is an easy sell. And what's on the prepuces, it's very exciting. Artificial intelligence is coming, probably quicker than before, quicker than we know it, before than we know it. Last time, so the future's bright, future's here. So it's our job, our duty to keep up, provided that it provides value to the patients. So thank you, everyone.
If you have any questions, we have a few minutes. It's kind of amazing if you haven't sat in on a Da Vinci surgery, and when the Da Vinci hit our hospital has 4 Da Vincis now. The older general surgeons were like, "There's no way, just not going to do it." Now it's kind of amazing. The chief of the VP of Surgical Services, he's a big Da Vinci guy. I go in there and I talk to him. He's doing surgery while he's drinking coffee. I mean, he's sitting off in the corner. We're not there with orthopedics yet, but you can see that, with things like the Think robot and automation, it has a potential for us. You want to know how we're going to meet the access issues. Well, it's kind of like an advanced version of what Jim Andrews does in his clinic. He sits there and he watches people, his fellows, operate in 3 or 4 different rooms. You could easily see that happening with orthopedics in the future. So it's one of those things that if you're not aware of what's coming down the pipeline, you may miss out on something. You're absolutely right. There's not an industry that's adopted this stuff that's gone away from it. So.
No, you made a great point. Status quo is good for a while, for decades, but status quo is not good anymore. The Da Vinci robot, I talked to my general surgery colleagues, also my cardiovascular colleagues and urology colleagues. A lot of this now has almost become the standard of care. And with regards to us, some may have the fear that it's going to take our jobs. I don't see that happening for a long time, because one, patients probably are not entirely trustworthy of having a robot completely do their surgery. 2, someone's got to do the approach and dissect down to the knee. And there's always good in terms of checks and balances, because there can be glitches. It can increase our longevity in terms of operating, because it's very physical, what we do. You guys are going to laugh at me at the age of 44, like I'm feeling it. Like the last 2 days, I was operating until 10 p.m. the last 2 nights. And I don't know how I'm standing, but took some Vicodin this morning. No, I'm joking. But yeah, it can increase our longevity, and that can also help with our work-life balance or decrease burnout, as we talked about. So.
All right. Well, thanks, Dave.
Yep. Thank you, guys.